Hi everyone, my name is Okeinfo Ajayi, and I am so excited that I am part of this conference. We're going to be looking at what are the educational trends post-pandemic in our classrooms with respect to what we do when we have an autistic child in the classroom. I cannot tell you how excited I am. I cannot truly explain it because this is a conversation that needs to be had. This is something that we need to talk about, and we just need to talk about. We don't need to talk about it just once. We need to honestly always have this conversation on the table. Now, as you're sitting there, how many of you are great at math? Can you please raise your hand if you're great at math? Okay, people like me would probably have their hands down because I'm not great at math. But guess what? That doesn't mean that I'm not great in other subjects of my life. Now, if you're somebody, it's a question two. If you're great at public speaking, please raise your hand. So that means that if you walk into a room, you can engage anybody, even if you don't know them at all, and just start to talk. Please raise your hands. Aha, not every hand is raised as well. Question three. If you're in this room and you're wearing a black shirt, please raise your hand. Okay, so I will raise my hand because I'm wearing something black. But guess what? I've given three different scenarios, and not everybody's hand was up. And that's the same thing with children who are neurodiverse. They may not be able to do everything everybody does, but the things that they can do, they do well. I speak well. I'm not great at math. I'm not even going to pretend as in I struggle with 3 times 4. But with Excel, guess what? I'm great at math. And those are some of the things that we're going to be looking at today. What are the adaptive technologies? What are the different things that we can do in our classrooms to ensure that every single neurodiverse child or children living with autism, as we are looking at, this is a conference that is focusing solely on mostly, let me not say solely, mostly on autism. How can we make them live fuller lives just because we care enough to say what is the next level here? The same way I use Excel in math, and that really helps me with my math skills. You would never guess that I'm not great at formulas, but I'm great at Excel. So I've adapted my needs, right? Using Excel. I've been able to pull up my needs and my skill set because I use Excel. And going through this conference, you have many speakers who are going to show you some amazing things that you can do if your child or a student in your classroom is neurodiverse, right? But one thing I would like to leave us with, I would like to leave you with it, even though I'm just starting, is because I'm less abled in one area of my life doesn't mean that I'm not abled at all. Because I'm wearing a black shirt and everybody here is wearing blue, green, yellow doesn't mean that I'm less or I'm not dressed properly. No, right? So we need to say to ourselves, what are we doing? Are we doing the right things, or are we simply just doing things because that's what everybody's doing now? Let's just do it. It shouldn't be that way. We should say to ourselves as educators, so I'm a teacher, right? We should say to ourselves as educators, every single child that comes into my classroom, I'm going to do the best that I can to ensure that this child is getting what they need from this environment, is having access to learning. And I mean, there are things like capsule curriculum, and we would go through some of these things that you can do as we go on the slide. But I just need you to make that commitment today, right now, at the beginning of this conference, and say to yourself, I will make a difference. I will make a difference because I can. I will make a difference because this is important. We don't make a difference because there's no other option. No, we make a difference. We choose to make a difference because that is the one thing that we as educators can do. My name is Okeinfo Ajayi. I'm an education strategist and I'm the founder of Busy Mind Center Limited. And it is an honor to be speaking with you today in this conference. Now, a lot of times we say to ourselves, this is how it should be. But I always wonder, because it is like this, does it mean that that's the only way that it can be? And the answer is no. There's always a better way. And we need to, as educators, think about a better way. Now, I'm saying as educators because you're in this learning conference. Education is not only something that happens in the classroom, education happens all around us, right? Which is why, I can't remember who said that quote that said, education is life itself. Every single day you live, you learn. Every single day you move, you learn. And because of that, the entire world is your classroom, right? So we're all here today educating ourselves, learning a bit more about what happens and what should happen in a classroom that has neurodiverse children in that classroom. And so what generally happens right now is three major things happen. The first is that we have children who are acting atypically. By atypically, I mean they're not acting as typically developing children. And so their skill sets might be a little different. I'm like, It's like that child has special needs. Oh, how do you know? And before you know what's happening, bam, we've slapped on the label. That child is autistic. That child is, and we don't know. We need to get a diagnostics. We need to insist on a diagnostics before we begin to slap those labels on. Peeling off a label, I don't know about you guys. Have you ever peeled a label and that label was smooth? No. You peel off a label and what happens is that what? Part of it is scratched, part of it is torn. There's glue everywhere. It's a mess. And that's what happens when you slap on a label on a child. It's more difficult to take it off. And so you don't want to slap on a label on a child. That's number one. Number two is that we have children who have been diagnosed, but then we have their primary caregivers, for example, their parents who, because they don't quite understand what is going on. Also, there's the issue of shame. And this is, it's very emotional for me. There's the issue of shame. There's also the issue of, did I do something wrong, right? But no, you didn't do anything wrong. It just happens, right? It just happens. Some of us are born with straight legs. Some of us have bow legs. Some of us have K legs. Some of us are atypical. Some of us are neurodiverse. We're just neurologically, there's something the matter there. It doesn't mean that it was anything that you did or didn't do. Even if there was something you did or didn't do, it doesn't matter now. What matters is we need to know that diagnostics in school, and we need to know how to move forward. The quicker a diagnostics is given, the easier it is for us to begin to work with the child when they're not yet set in some ways. And as teachers, we're not stabbing in the dark. We're not just saying, okay, what, let's try it. It's not kalo. This is the life of a child that we're looking at here, the life of a family. And so we need to know. So please don't hide the diagnostics. But that's what happens right now. Please don't hide it. The third one is, my school cannot take special needs, so please carry your child and be going. Really? Really? You're an educator. You can't do that. I know that it is difficult, and I'm not saying it's the easiest. So my school, for example, is a mainstream school. And so when I have neurodiverse children coming into my school, it can be a little difficult because guess what? We have to kind of change so many things with the operational structure of the classrooms just to make it work. But it's worth it. Okay? And so it's not for you to say, I beg, I no fit. It's for you to say, how can I support this child? What are the things that I need from the parents? What are the things that I need from developmental psychologists? What are the things that I need to do with my teachers, for example, right? And when you begin to think like that, those three begin to change. The first being the fact that there are no labels, and then there are no diagnostics, and then we're slapping labels on. The second being parents who, don't quite mention it, even when they know, or don't want to even go and get a diagnostics when the school has pointed out that there might be a need for one. And then the third is a school that just says, I don't fit, I can't do this. We can't live that way. That I'm not great at math doesn't make me less of a human being than you, who is a mathematician, right? Which is different. All right. So we need to create supportive systems at home, within school, and of course via developmental centers. That's something that is really important, and we really cannot not do something about it. Yes, so neurodiversity is children who are presenting differently. You've probably heard me say this a lot of times, right? And I charge you today to go and find out the meaning of neurodiversity. Okay, you need to go find out that meaning because it is important for you to know what it is. Okay, autistic is a neurodiverse syndrome, but beyond just knowing that's what it is, you need to understand what it is and how you can fit into it. Because guess what? If you look around you, statistics say that I think 7 or 1 in 71, I can't remember that exact statistics right now, is neurodiverse. Actually, it's autistic, but the percentage of neurodiversity is even greater because there's so many neurodiverse syndromes out there, right? So somebody beside you, to the left or to the right, could be neurodiverse, right? And we're not going to walk around and say we're going to talk to people with black shirts, or we're going to only talk to people with white shirts. We have relationships with everybody, and so you need to understand that we live in a neurodiverse world. And this month in April, we've moved from autism awareness, to autism acceptance, right? So, and that used to be what it was. We used to be talk about autism awareness. What happens with awareness is that we're pointing a finger. We're saying, that child is autistic. That parent looks like they're autistic. that person. And that's awareness. You're raising an awareness about something. But when you've raised the awareness and people already know, you need to then move into the place of acceptance to say, you know what? Not everybody here is wearing the same shit colors as I am. Not everybody here knows math like I do. Not everybody here is a public speaker like I am. But guess what? The skills that you have or don't have don't make me the judge of you. They don't define you. And so I'm going to accept you for who you are, for what you can or cannot do. And that's where we need to go. And that's what this conference is about. Yes, we're going to talk about some things that you're not aware of, but guess what? Most importantly, we need you to move into that space of acceptance. Because the minute you accept somebody and accept a thing, that's the minute that you open up your heart to them. You're more open-minded, you're more able to see solutions, and guess what? You're more willing to help. Now, it's not anything new. It's not a hidden. It's not hidden that during the pandemic, it was crazy for every sector, but education was even crazier, right? Because we had to move from where classrooms that were functioning regularly to classrooms that weren't functioning regularly. We moved from seeing the children every day to seeing them via a screen. We moved from even understanding how to teach in a regular typical classroom to teaching via technology we had no idea existed prior to COVID-19. And it didn't just affect one person, it affected the entire world. And that's the same thing with autism, right? And that's why I said when we talked about neurodiversity that there could be somebody around you who's neurodiverse. You just don't know. They've grown up with it and they're adults who are autistic and have never been diagnosed. And you're wondering, oh, why does this guy behave like this? Why does she behave like this? They're just autistic, right? And they don't know that they are. But there's certain skills that they don't have, right? And I would share some of the skills as we go along. But you need to understand the fact that there was an impact, and that impact that happened because of COVID-19 is not going to go away. I don't know about you guys, but the amount of online businesses that exist right now are triple. There's so many of them right now, so many. And the reason is there's just a whole new world that opened up. It's not just for businesses. It's not just for conversations. It's for education as well. And imagining that we can shut down the online sector is closing our eyes to the realities of where we are right now in the sector. Now look at the disruptions already going on. You have things like U-Lesson, there's so many of them. Even I have one in my school as well, and I'm creating another one. I'm building, making it a little bigger. Why? There's always going to be a need for the online platform. There's always going to be those people who want to homeschool. There's always going to be that family who cannot maybe afford full-time school. So are they not going to learn? And then when we think about access, which is an SDG goal, SDG 4, access to quality education, the only way to really do that is using technology, right? Because guess what? Your costs are dipped. So I just want you to know this reality, okay? And understand the fact that some of the things I'm going to be sharing in this slide are going to talk about how you can leverage technology in the world that we live in today. Yes, so what is autism? I'm sure you're wondering, but she should have talked about this a long time ago. You can't tell me you don't know what autism is. I mean, if you don't know what it is, if you see somebody who you assume is living with autism, you may probably be able to say, I think that child is autistic. So it's not the definition, right? Sometimes it's the presentation. It's the saying, I'm going to do something differently. And I have pictures on this particular slide that actually show you things that you would notice in a child or an adult who's living with autism. Because yes, we do have children who, adults, I beg your pardon, who may not have gotten a diagnostics, but they are living with autism. All right. So some of these would help you. I mean, some of it you learn over time. So you would notice something in a younger child and maybe not in an older child, because that older child has adapted, has grown adaptive skills, has learned what to do and what not to do, has kind of understood how the world works and has plugged themselves into the way the world works. But generally speaking, autism is a developmental disability, and what happens is that it's on the spectrum, and there's just something on the inside of the autistic person living with autism that makes things just slightly more difficult for them. Okay, they don't relate with people like everybody else does. They have problems with communication. They have problems with social skills. You would notice that they're spinning around. You notice that they're fixated on certain things. So I have children in my school, for example, that love a particular object, a material in the classroom. They just don't want to let that material go. And if you take it from them, oh goodness, we can spend 45 minutes trying to calm them down, but then we know what the issues are, and we've kind of learned how to manage that situation. But those are things that you would see in your classroom. And I'm talking about your classroom because I know that every single one of us here is an educator. You might not be in the classroom teaching. It doesn't mean that you're not an educator. You're walking on the road and somebody is not walking properly, and you tell them, I work well. Guess what you've just done? You've taught them something. And that makes you a teacher. You're sitting down in the classroom and in this conference right now, and you're listening to people and saying, oh, I like the way that person just spoke. Guess what you've just done? You've learned. And so that puts you squarely as well in a classroom. So a classroom is not the walls with the board. A classroom is life, because every single day we learn something new. And that's what we're hoping that you go away with from this conference today. Now, these are things that I thought was really important. Again, moving to the place of acceptance, right? And then we'll go deeply into the education part of things. Every child with autism actually wishes you knew these 10 things, and wishes that you began to do these 10 things, because they're human, and it can be painful to not be accepted for who they are, right? I'm not a very tall person, and there are times where I'm wondering, why am I the shortest in the room? People are taking a picture and they're wondering where to put me in the picture, and sometimes I can feel very self-conscious, but there's typically nothing wrong. I'm just not tall enough, right? So imagine there's somebody who has to live their entire life trying to find their height. That's such a difficult thing to do. I only do it once in a while. But that gives you a clue into the lives of an autistic person. Every single day, they're trying to make sense of this world that they have been put into, that is not generally designed for them and for their skill set. That's not okay. We shouldn't make it worse. We should make it better. Every child can learn. Every single child can learn. And you need to accept that. You need to believe that, okay? So your child might be autistic, or on the autistic spectrum. Your child in your classroom might be. You might know somebody who is. With every child, I beg your pardon, repetition is the law of lasting impression. And so the more you say something, do something, teach it, they begin to learn it. It begins to permeate into their systems. It might be slower with some children than with others, but they would eventually get it. Every single child can learn. Say it to your neighbor, to two neighbors, turn to the left, turn to the right, and say to them, every child can learn. And they cannot only learn, they can learn very well. Okay, and it's important that you get this. Now, these are current trends that we see in education. The reality is learning happens everywhere, whether you agree or not, which I've just explained, right? You're walking down the road and you're driving and somebody drives, beats a traffic light, and you're like, how could they do that? Guess what? You've just learned one way not to do something, right? You know that at a traffic light, when it's red, you stop. When it says amber, you get ready to move, and then when it says green, you move, right? So that is something that you've just you've further reinforced, right? Because it could cause accidents when you do the wrong thing. So learning honestly happens everywhere. Technology in education is a priority. And I'm not kidding about this. It's a priority. Now, most people, when you think about technology, they think about some big gadgets. It's not. Using a phone is technology, okay? It would help children to learn better. You can also communicate with parents better. You can do your research easier. And it's important for you as a teacher, because you cannot just rely on textbooks. You need to look at different perspectives for that topic that you're looking at, and not just different perspectives. If you have children who are presenting with autistic syndromes and symptoms, what you can then do is, maybe symptoms is a wrong word, characteristics that are indicative of autism is a much better way to use it. So my apologies for saying that. But if you then have a child who is presenting those characteristics, what you can then do is say, how do I teach mathematics to an autistic child? How do I teach multiplication in 1 times table, 2 times table, 3 times table to an autistic child? So much is going to come out at you, right? And what you then do is you take that and you use it in your classrooms. Of course, there are many auxiliary learning platforms, which some of my really fantastic co-speakers are going to talk about. What are the technology, what are the auxiliary platforms that you can use? For example, I use Excel. I'm not good at math, but guess what? Excel is my auxiliary brain when I have to do calculations and use formulas and things like that. what is happening right now in education is that we're also weaving socialization into both the online classroom and the regular classroom. So it's not just about what is happening in the classrooms, it is what is happening everywhere. And then we're using a blended tool for education. So a blended learning tool is, I'm not just teaching you everything in the classroom, I'm also asking you to go do some research by yourself. So we're using a hybrid model right now, and that is something that is not just for typical children. Every single child can learn like that, and it's important that you believe it. So of course it is important for us to bring in the parent into education, right? And if you're a parent here, I'm so happy that you're here today, because you need to understand this. There's an intersection between education and the parent. Okay, education being the school. There's no way that we can do this by ourselves, right? We need you to make it happen. And one way that you can help us make it happen is help us understand who your child is at home, help us understand the things that your child does at home. I've had many instances where we're talking with the parent and saying, "No, your child doesn't speak in school," and they're like, "Oh, that's it. That's a surprise. My child is constantly talking at home." And we say, "Okay, please record a video and send it to us." And it takes weeks before we get a video. We're not on different sides of the table. We're on exactly the same side of the table. The goal is, how can we support this amazing child to be the best that they can be? So if you keep seeing us as the enemy, as somebody who's stressing you out, it's going to just make things more difficult, not just for your child, but for your family, and to be honest, for the school. And we can do without it. All right. So we are on the same side. There's an intersection between us, and so we need you. We need your support the same way you need our support. We need you to let us know exactly what is happening in the classroom, happening at home, so that we can support what we're doing in the classroom with the things that you are doing at home. It is also extremely important that you get a developmental assessment. You have to get a developmental assessment. It doesn't matter what somebody has said. And you're not getting a developmental assessment from a doctor. They're two different people. There are developmental psychologists. In this conference today, there are loads of developmental psychologists. And so what you want to do is connect with one of these people here today and get your child diagnosed, right? Get your child assessed, get your child evaluated. And what that does is that it shines the light, right? Knowledge is empowering. The more you know about a thing, the easier it is for you to even begin to do something, either right or wrong about that thing, right? And then when you choose not to do anything, you know the implications of not doing anything and what that would cause. All right, so you need to get a developmental assessment, and you need to do it not from a regular doctor, because they're not developmental psychologists. It's like me going to ask a pharmacy about my symptoms for asthma. They might know something about it, but they're not asthma doctors, right? They are specialists who deal with asthma, right? And so it's the same thing. I'm not saying they don't know what they're doing, they just don't know as much as they could about developmental psychology. Okay, so please get an assessment, and get one from a developmental assessment. That is one way that we can work together, right? Because if you're putting your child in mainstream school, they need to know what is going on. If not, then they just don't know. And what they don't know, they cannot give your child the very best. Okay, so you need to get an assessment. And if you're bringing your child to mainstream school, some of the things that you need to have as a parent is you need to be patient. Okay, yes, teachers need to be patient as well. Of course, I mean, it goes without saying. But you, the parent, needs to be patient. Things don't happen like that. We don't have a magic wand in schools. We work with your child based on what level they are, especially if their chronological age is way less than the developmental age. And I'll explain that again. There's some children who developmentally, chronologically, I beg your pardon, their age in number of years could be 5 years. So they're 5 years old, and you will celebrate their 50th birthday tomorrow. But when we do a developmental, even an easy milestone check for the child, what we'll find out is that the child's skill set is about 2 years. So developmentally, your child is 2 years old, right? So we need to move from 2 years to 4 years, and that's going to take some time, right? So between 2 and 4 is how many numbers, right? So You can't then assume that because things are getting better, it's just going to just jump. It doesn't happen that way. So you need to be patient as a parent. You also need to understand, and this is for the school now, you as a school, as an educator, you must be patient, you must be compassionate, you must be very forgiving, okay? And you must be ready to give of yourself, give of your time to find out a bit more about children living with autism so that you can be supportive of them in the classroom. You also need to teach the other children in the class the right skills and the right way to treat somebody, to relate with somebody who's living with autism, because the person living with autism might just not know. They just don't know how to behave. They don't know that that thing that they've done is not okay, because they're very literal. If you tell them, carry the chair on top of your head, they would literally take the chair and put it on their heads, because that's how they interpret things, right? They don't understand the nuances. So you're going to have to educate yourself. Okay. Of course, 71, the data says that 71% of autistic children attend mainstream school. So there's no reason why the children who are autistic cannot be in mainstream school. We just have to have the supportive systems to ensure that things work the way that they do for the benefit of the child. And I loved this, right? Mainstream is, you need to do it at the appropriate time. If a child has started to have behavioral difficulties, because of maybe sensory overload, so many other reasons, to be honest, then what would happen is if you bring that child to school at that time, it might be really difficult, because the child is going to have to deal with not just themselves and fitting in, but then they have to deal with everybody else's emotions, and that can be really difficult for them. So it's typically easier to put your child in school early, but there are some parents who don't want to put their child in school early. If you notice there's something maybe not quite developing well or presenting well in your child, a certain character that you're like, what's going on here? Then you want to seek help, you want to seek support quickly, so that we can begin to work with your child to gain the skills that they need to manage that particular behavior, because it's going to live with them forever, right? They can get better at handling it, but it just doesn't go away. All right. And I talked about inclusive classrooms, right? In our schools, one of the things that we need to do, and remember when I started, I said, I'm not going to talk about trends. I'm going to talk about things that we must do, because it's important that we do these things. Okay. So beyond mainstreaming at the right time, we must have, for schools now, so a parent needs to mainstream on time, but as a teacher, as an educator, as a school, you need to have inclusive classrooms. And I'm going to show you how you can have an inclusive classroom. It's important, right? Because even children who are typical, we don't all learn in the same way, right? So it is only right that you teach the highest level of the class, but you need to understand that every pod body in that classroom would access it. And so building scaffolding, giving support systems that help every child to access that education is something that you definitely want to invest in terms of skill and in terms of some certain materials for your classroom. Now, this is how to set up an inclusive classroom. It's a 5-step approach, and it has helped me immensely, not just in setting up an inclusive classroom, but in life in general. All right. So you want to take a picture of this slide, or you want to write it down, and then you want to bring this into the things that you do in your classrooms. The first thing is that you need to understand the needs of the child. Who is this child? What do they need? Of course, what would help you the most is a developmental assessment. Now, in every developmental assessment, it needs to be interpreted for classroom use. Okay, so mom and dad can go get a developmental assessment, but then you might need an interpreter, okay, who would then take that assessment and interpret it. Because for a teacher, of course, you can interpret it, but there's some things that you may not truly fully get the full picture, because again, you're not trained in developmental psychology, you're not trained in special needs analysis, you're not trained in IEP development and management, so you might be unable to do it in the best way. Okay, and so that means that things will be lost in interpretation. So you want that report to be interpreted by a specialist, and there are specialists who interpret reports. Okay, and I'm sure in this conference you can get people to do that. What you can then do is, once they've done that for you with classroom interventions, so they need to give classroom interventions. What should I be doing in the classroom? That needs to be clearly stated, and that helps you understand the needs of the child. Your step 2 is then to review your environment and say, what do I currently have? What can I do with what I have? And you look around and then you say to yourself, okay, this is what I have, and this is how I can make it work. Then guess what? You go to your step 3. You determine what you need. This is what I have. This is how I can make it work. So what do I need? That's carry out a needs gap analysis. Based on the needs of the child, what is your need gap analysis? What you have versus what you should have. When you've determined that, then you need to talk to the special needs learning guide or the facilitator for support, right? Talk to the parents as well. Of course, you must talk to your admin unit in your school even before you start to do these things, and say to yourself, this is what I need to create a really inclusive classroom. How can you guys support me, right? And then you go to step 4, you bring it all together. Okay, what I need, what I have, what I should be doing, how I should be doing it. You bring it together and you create an implementation plan. When you create an implementation plan, I would like to caution you that don't rush into it. Okay, always run a pilot. Okay, so try a few things out. What if they don't work? Stop them and switch. Okay, so don't just say this is my implementation plan and you just carry on like that. No, it just doesn't work that way, right? Because people change. A child might come in one day and they're able to do certain things. On another day, their skill set might change. Are you going to keep going straight even when the child is going left? No, you're going to have to turn with that child, right? So that you can create a truly supportive environment for the child. And then step 5, when you have done all of these things, step 1 to 4, you then need to check it. Okay, check what it is that you're doing. Measure the impact versus that's the impact now is what it should do versus what it is doing. And then you evaluate and say to yourself, I need to change things. All right. So again, it's the same thing. A child used to go straight and then they suddenly turn in left. And then you're like, you know what? I can't turn. I beg. No, you can't do that. All right. And these are important. I've talked about the importance of technology, right? You cannot run an inclusive classroom without using technology. I think it's impossible. Why? When you look at the concept of differentiation, and this is not a differentiation classroom, so I will try not to be very education focused, but I'm an educator, and I'm very proud of myself being an educator. However, when you look at technology, you need to understand the fact that technology gives you more hands, more eyes. It increases your skill set as a teacher, as a parent, as a consultant, as whatever it is that you decide to be. So what you can do is some of the gaps that you've noticed in your classroom in terms of implementation, technology can bridge that gap. Where all of the other children, for example, may be writing off the board, your autistic child may not be able to do that. And so what you do is that you give them a tablet and the parent will provide the tablet. Of course, if your school does tablet or computers, then that's fine. But the child gets that. And what they do is that they already have a tool or an app where maybe they are writing the numbers. Okay, so they're practicing that writing on the screen. They will be very engaged because the usual. I mean, there's typically a lot of tunnel vision when you're working with children living with autism. But beyond that, they're learning while the other children can carry on learning. So that minimizes the disruptions in your classroom. All right. And there are many other technology tools, which I'm sure a lot of the other speakers will talk to you about. And again, just going into interactive technology again, right? So there's tons and tons of interactive technology that helps with listening. It helps with reports. It helps with social skills. It helps with reading. It helps so many, right? But you're going to have to say what is the right technology for the student, and then you need to find it, test it, try it out, right? Before you then say, oh, you know what, this is working, and even then be ready to change it. So what are the benefits of interactive technology? Some of the benefits of interactive technology is, like I said, it increases your skill set. Okay, for you, the teacher and the parent, it increases your skill set. It allows you to be more flexible in the classroom. You're able to connect with a lot more students. So this type of technology, you don't only have to use it for the children living with autism. You can actually use it for the other children in the classroom. And guess what? We're in a digital age. Children who are maybe less than 16, 17 are digital natives. So you really cannot sit down and say to yourself, I'm not going to use technology. You have to. If not, you're grooming children who are not going to be able to function in the world that they would be in when they're adults. All right. So once again, it's important for you. And when I say teachers here, I'm talking everybody. Okay. So you're the parent, you're the consultant, you're the special needs expert, you're the special needs facilitator, the shadow, and the teacher. This is what technology does for you. All right. And then for the child, because it's not just about you, it's about the child as well. What does technology do for this child? It helps a more personalized learning experience because it's now about the child. Do you understand what I mean? You can say this child will need this, so let me create this. The books and the boards and some of those things do not actually allow you to be as flexible as you should be, but technology, personalized technology, actually helps you do that. And of course, it improves the communication skill of students. Yes, it does, especially in terms of writing, in terms of eyesight coordination, in terms of reading, listening skills. So all of that is part of communication skills, and it really does help with that. You can tell them to send you a chat, to type it in the chat box. All of those things are ways that children are developing their skills. And of course, like I mentioned earlier, it does help the children prepare for the future. And so what are curriculum and home interventions? One is, classroom and home interventions that you can begin to look at in your classroom. One is the curriculum. So there's something called the capsule curriculum. And what the capsule curriculum is, the capsule generally is, think about think about what a capsule is, right? It's yellow and red, or black and white, or whatever color the capsule is. But all you see is the red and the black. But inside that capsule, there are all sorts of things. Sometimes there's powder, sometimes there are pellets, all sorts of things inside the capsule. But all you see is the red and the black, or whatever color your capsule is. Now, one thing that the capsule curriculum does is it allows you to pull in the elements of the main curriculum into just a capsule, okay? And so you're not looking at all the 14 subjects. You're looking at maybe 3: math, English, and sciences. And what you can then do, again, using technology, is to deepen your subjects using examples that are math-based, that are history-based, that are science-based, that are social studies-based. Social studies topic, for comprehension passage, for example, is what maybe this child can look at. Okay, and that's a capsule curriculum. It's the same thing with just pulling in. Why? So that you can strengthen the skills using just that capsule curriculum, but then it opens up a lot more because of the examples that you're using. Okay, so you can have some curriculum interventions. You can integrate as well, and that's what a capsule curriculum does as well. It integrates several different curriculum areas, but limiting it to 3 major curriculum areas that are visible to the child. Okay, of course, training of your staff, in understanding a bit more of what's children living with autism need. Okay, and then of course, not just what they need, but then pedagogy. How do you teach children who are living with autism? That is also important. And one thing you do is that you chunk the curriculum, you chunk the learning goals. First of all, you need to pull it maybe a bit little down, depending on the developmental age. If your classroom is a 7-year-old class, for example, and that child living with autism developmentally is age 4, you're going to have to say to yourself, what do I need to do? How do I teach this? How do I chunk it and teach it to this child so that the child can understand? Okay, so that's something that you're going to have to do, and that takes training and that takes practice. And then of course, parent feedback, getting the feedback from the parents and giving the feedback to parents as well. Those are really important. Now, these are strategies for supporting teachers, so for supporting students living with autism spectrum disorder. And these are things that you can do with them, right? And it's not just happening in the classroom, it should also happen at home. All right, so please take a picture of this, and then it would help you to look at it and say, okay, these are things. Have I tried this? Have I tried this? Have I tried this? And you can then try them and begin to see what is working better and what is not working better. Some things might work better in the mornings and some in the afternoon. So just track all that progress, write it down somewhere, right? So that you can use it functionally in your classrooms. Now, one thing I wanted to mention here is when you start on this journey, okay, you're coming from a place of ignorance, okay, because you don't even know what is going on. You have accepted it, but you don't know what is going on, right? And that is an unconscious, incompetent stage. You're not even conscious that you don't know it. From there, you move into the space of awareness. You're like, oh, this is what I should be doing. And what happens is that you're vulnerable because you don't really know it. So you know that you don't know it. And so what's happening with you there is that you're consciously incompetent. You know that you don't know. And that can be very vulnerable. And that's when you then see either parents or teachers saying, what is it? I beg, there's nothing wrong with my child. Or I can't do this. You know what? The child is always disrupting my class because you don't want to be vulnerable. You have to be vulnerable so that you can move into the space of knowledge. And what happens is that you then go to the stage of conscious competence, because you're now learning what it is that you do, what it is that you don't know, to do the things that you need to do. And that's okay. Every single phase, you grow within each phase. You cannot be in a phase of awareness and you're expecting mastery. Please don't do that to yourself. All right. So I wanted to put this because I thought it was really important for us to understand that it's okay to be vulnerable, but you're only vulnerable for a short while. After that, guess what? You become that master at it. All right, and this is how, of course, to turn that vision into reality. You need to have a plan, a big vision. You need to break it down into specific roadmaps and then specific action steps, right? And each one, there's a result tied to it. All right, so this is really important. We all, to be honest, need to be ready to do what it is that we need to do. So what needs to be done? You need to be ready, because it's not about us, it's about the future of this child. And if we're not doing what we need to do, then are we really setting up that child to be fully functional adult in the future? The answer is no. So they're autistic, but they're not less human. Okay? And I've shown you many strategies that you can use in developing yourself and creating an inclusive environment, both at home and in school, for those children. But you're going to have to be ready to do what it takes. Autism is not a disability, it is a different ability. Yes, it is called a developmental disability, but it doesn't make them disabled. They are able. There are many things that an autistic child or an autistic adult can do. You're going to have to find it. These children have to matter enough for you to accept them, to love them, and to support them in the ways that make them the best that they can be for their future. Thank you very much, very much, for allowing me to be in this conference and for allowing me to share with you. I honestly wanted to be there, but I just couldn't be there. And so this was the next best thing to being there. Thank you all so much, and God bless you.